This is a pandemic.
Tonight, like no other media outlet in the state can do, 6 television stations broadcasting to all 55 West Virginia counties and our neighboring states to answer your questions about the coronavirus.
We are very high risk, so we've got to be concerned.
Your questions.
Stay calm. Be smart.
Your concerns.
They need to take care of their parents, their grandparents, and their great-grandparents.
Answered by the experts.
I have enough tests to maybe 500 people.
Only the facts.
It's serious. We can beat it, and we will beat it, but we've all got to recognize what we got to do.
Not fear.
It's a time for us to rise up and be what we are. West Virginia, Mountaineer strong.
Welcome to Facts Over Fear, the coronavirus, a special edition of West Virginia Tonight. Now, here's Mark Curtis.
Good evening, everyone, and thank you for joining us. I'm Mark Curtis. Many of you watching at home are scared, nervous about the safety of your family, nervous about the future of your job, and rightfully so. Many of you watching lived through the terrible days of 9/11, the real estate crash of 2008, the health scares of SARS and Ebola. But not since World War II has our nation faced a crisis of this magnitude. Over the next 60 minutes, we're going to put the questions you have sent in to us to those with the best ability to give us the facts. Joining me live in studio right now is West Virginia Governor Jim Justice and the Dean of Health Sciences at West Virginia University, Dr. Clay Marsh. Joining us shortly will be the Secretary of the Department of Health and Human Services, Bill Crouch, and West Virginia State Healthcare Officer, Dr. Catherine Slemp. She'll join us shortly. Governor, we'd like to start by giving you a few minutes to address all of us here in West Virginia with the latest information and your thoughts on this crisis at this point.
Well, Mark, I appreciate that. And I would say to everyone, it is a time to be really concerned. This is serious stuff. But it's not a time to be afraid. It's a time to really be smart. It's not a time to panic, as I've said many times. It's a time really and truly to just move forward and try to make the best moves that we can possibly make. We absolutely have to do this. We have got to try to stay apart. It's the very power, the very, very power that cripples this terrible monster, this terrible disease. If we can just stay apart from one another, stay apart from the gatherings, really, really know that to those that are exposed the most are the elderly. And we've got to step up as West Virginians. We've got to step up and say just this. We know this is a terrible inconvenience. We got that. And we know that it is an economic disaster. And we're worried about our paychecks and being able to pay our power bills and pay our taxes and absolutely put food on the table. We know all of that. But I tell everyone just one thing, and it's just this simple. We can't replace loved ones. We're going to be okay economically because our nation is going to step up and our state's going to step up, and we're going to be okay economically. We've got to first and foremost look after us, and we are blessed with our mountains and our communities that are spread out in so many different ways. But now we've got to take the other additional steps because we all know we're a really high risk state. We are absolutely a high risk state. But if we employ all the things and all the advantages that God above has already given us, we'll be okay. But this is serious stuff. I don't want you to be afraid, but I want you to know that you've got the greatest healthcare people in the world that are working this every minute. We're on top of it. We're absolutely on top of it. And absolutely, we're going to be okay.
Governor, thank you for your opening remarks. We're going to delve into a lot of those topics you talked to, employment and health and testing, all those things over the next hour. First, let's talk about the latest numbers. How many confirmed cases do we have in the state? How many people have been tested approximately? And we understand you yourself have been tested. Talk about that too and what the results were.
Well, that came about, that was a little bit of a real scary moment, to tell you the honest truth. But, I've had a little bit of a cold, and you're concerned about that and all that. But, it's just a cold, and you don't feel bad and everything. But then today I just happened in, I knew that about a couple of days ago that a lady that her husband was our first confirmed case in the Eastern Panhandle. I knew that I was with them as I was giving out minority grants, in Martinsburg. And so I strolled back into my office today, and here sits the rubber gloves and a lady and everything, and says, "We're going to have to test you right now." And I said, "Well, what in the world is all this?" And Dr. Marsh and our Secretary Crouch and everything has said, "You got to be tested because we have a picture of you standing with the gentleman that was the first confirmed case. And to be perfectly honest, what a wonderful man and a wonderful wife. And I'm hugging them and everything. And I remember all this and everything. And so they test me. I went over self-quarantined myself. And it just so happened they were just running a batch and everything. Came back in, about 3 or 4 hours that I was negative. So that was good. So, but it was sure a little bit of a scare.
Well, you get chills just hearing that story, because I'm sure other people may have experienced a similar thing. So we're going to talk about we're glad you're negative, first of all. That's good. And we're going to go forth and talk about a lot of the other topics that you delved on in your opening remarks. In many of your press conferences, you have repeatedly stated that West Virginia is an elderly state, it's a rural state, and is at extremely high risk because of that population and the fact that we have the highest rate of diabetes and obesity and other health problems in the state. Talk about that, and I want Dr. Marsh to weigh in too.
Well, we are an elderly state for one thing, and then we've got a lot of people that have developed diabetes and obesity and COPD from working in the mines and all kinds of stuff like that. And so we have all the ingredients that could cause us a real problem. Now we have all the advantages, and you'll hear Doc talk about the power that we have that kills this disease and everything is the ability to be apart. And as we are apart, it cripples this disease, because this disease can only feed on us being together and everything. And we're ahead of the curve because we had a state of preparedness and we did act proactively, and lo and behold, we are absolutely way ahead of the curve. I mean, you look what's happening in New York right now. It could be a super disaster. But anyway, I'll pass the ball to.
I'm going to ask Dr. Marsh, because we should underscore, we have 2 confirmed cases in the state. How many total approximately, Doctor, have we tested?
We've tested about 500 people now with the new opening of the drive-up and drive-through places to test for WVU Medicine, CAMC, and so we are expanding that capability every day.
Does it surprise you when we say we've only had 2 cases, yet the governor and everyone else continues to talk about how many high-risk people we have in the state? It just seems that we have more cases because of that, or is it because it's a rural state and people are pretty spread out?
Yeah, I would say that so we do have a rural state, and the sort of some of the things that people have criticized us for turn out to be our greatest advantages. We have a lot of natural firewalls, small communities, distances between people. We don't have a lot of people in and out. And so ultimately what we know from looking at China and other places around the world, if we can maintain and stop the spread of the virus in a very fast rate, so we don't get this surge of people where the hospitals and the health workers can still function, the mortality rate across the world is 1%. If, though, that we get the tsunami wave, the surge, and we overwhelm the health system like it is in Italy right now, with people that are older, like our population, the mortality rate is somewhere between 3 and 7%.
Wow.
So what we're really trying to do is the governor has led the efforts, and I'm so proud of him, that our real power here is to have people separate. So that kills the basic way the virus gets between us, and also to wash hands very carefully, because the virus can sit on countertops and other things, and then we get our hands around our face. So wash your hands carefully before you eat something with your hands, and keep your hands away from your face.
We promised our viewers in all 55 counties of the state we'd let them ask some questions tonight, so let me take the first one. I want to answer a viewer question. This comes from Mike Pavlik of Martinsburg, who is watching on WDVM TV. He wants to know, if COVID-19 appears to only manifest itself in a few of our cities, would you consider restricting travel within the state in order to protect those in rural areas? Governor?
Well, restricting travel or recommending against travel are 2 different things. But to the degree that we can not travel, not across state borders, not into other cities. You know, the fellow that I think was confirmed first had gone to maybe, you know, a wedding, you know, and where a lot of different people were there from different countries even, you know, I think. And I don't know that specifically, but I think that, you know, and the more we do in the near term, the higher the risk becomes. And really and truly, so what I'm saying is, the lesser we do and more separated we stay, and the more we work at home, and I employ all of our you know, businesses to try every way we can to let our people work at home as much as possible, because the more we do that, the more disarmed this virus becomes, and as it becomes disarmed, it gives us a great opportunity to restore life back to normal.
I want to jump from this point to the discussion of hospitals, because we, again, have a large elderly population in the state. I want to talk about hospitals because West Virginia is a rural state with a lot of rural hospitals, and as we speak, Fairmont Regional Medical Center closed this evening forever. Bluefield, Richwood, Wheeling have also lost hospitals, and Williamson Memorial down in Mingo County has filed for bankruptcy. How is the state reacting to these closures, especially in the rural areas, and how can we help our hospital capacity? We'll ask both of you this.
Well, let me go first, and you take over and everything. But look, nobody has worked harder to try to save the Fairmont Hospital than myself, because we can't lose our community hospitals. First of all, they're giant employers. Second of all, they're almost the heartbeat of the community, and we cannot start just staging up ambulances and driving people, you know, 2 hours to a hospital. We're going to lose all kinds of people. We have got to step up and be able to save those rural hospitals. Now, we came up with a great plan at Fairmont, and we worked it really, really hard. Instead of it being a 10-bed emergency room deal, you know, we got it to where these great people stepped up and everything, and they're going to build a big hospital, employ a lot of people, and they're going to keep Fairmont operating and going. But the rural hospital thing is something that we have got to solve that riddle. Now I'll pass to you, sir.
Yeah, I think that, you know, if you look at healthcare in general, we know that we are not built for the sort of the issues that are happening today with the COVID virus across the world. And I think that this opportunity to rethink about how we have relationships with the small rural hospitals in the state. And so I think this kind of hub and spoke model is what will really work in the future. We have hired about 700 new physicians in the last 5 years at WVU, and we have some of the best people in the world. We've done 4 of the first time things in the world from Morgantown, so we can't replicate that everywhere. So we want to be able to keep those hospitals and clinics and critical places open in communities, but also have the ability to send people up who are the most ill that we can take care of.
I want to bring in one of our viewer questions because it's very much related to this topic. This comes from Crystal Newsom of Breeden, West Virginia. That's in Mingo County. She's watching us on WOWK-TV, and she asks, what about rural medicine? What are private practice doctors' offices supposed to do? We can't get personal protection equipment and have no hospital affiliation. She goes on to ask, is there some help for these small physicians' offices? How can we continue care when we are unable to get the safety devices that we need? Doctor?
Okay, I'll take that one. So I think that that's what's so exciting about what we heard tonight with the acquisition of 100,000 N95 respirators, which are really that critical mask that people wear that doesn't allow the virus to come in or other infectious particles, and some of the suits and the protective wear. So we, working with Secretary Crouch and Commissioner Slim, want to make sure that we help provide all of the right resources to all of our providers in the state, and we can only do that when we work together. So we need to work not in parallel but in series, and so we're very, very happy to try to meet the needs with the Secretary and the Commissioner for rural hospitals and rural clinics.
Governor, as mentioned, this whole situation has all of us very, very worried. We're going to show a short video clip here, a question about sheltering in place from one of our viewers at WFRX-TV. Let's hear it.
My question to the governor or state leadership would be whether or not there are plans to enforce a statewide shelter-in-place order, even for us healthy adults, whether or not we should really avoid work and stay home.
Again, this gentleman asking about the possibility of a shelter in place. We see one in the San Francisco Bay Area. We see one in New York City. Would a shelter in place be appropriate at some point in time in West Virginia? Both of you.
Well, I hope and pray that we don't get to that stage. And to be perfectly honest, by us being, proactive in what we did and everything, I think we're set up in a situation to where we won't get to that, but I'll go to my expert again.
I appreciate that. So there's a really interesting mathematical simulation where you look at the spread of the virus. And we're trying to slow down the spread. That's the tsunami wave. And what it shows is if you don't do anything, it spreads like crazy. But if you do a forced quarantine, it spreads not as bad, but still too bad. What we really need, and that's what the governor's done, is to implore our citizens by choice to separate, because they're not only protecting themselves, they're protecting these vulnerable people. Kaiser Family Foundation said that we had the highest risk population in the country. And if we do this right by voluntary, 75% of people makes the tsunami wave a river, 90% of people that self-select to stay in their homes, etc., makes the tsunami wave a stream. And if we do that, we thrive when other people are going to really, really struggle.
Now, we're having a good conversation.
Yeah, but let me follow up with that and everything, and say just this. And I want everyone to understand the tsunami that Dr. Marsh is referring to is if we get mass infection and everything to where so many people are infected and everything, and then all of a sudden what happens is we flood our hospitals. Well, we can't take care of them, and then all of a sudden we have incredible mortality. But if we have a 75% separation level, then that tsunami turns into a river, and at 90% it turns into a stream. We're able to handle it no problem.
Well, we're having a good discussion here, and we want it to continue. Thank you, Governor, and thank you, Dr. Marsh. We'll talk more about this. I know tens of thousands of people who are watching appreciate the straightforward answers they're hearing tonight. Coming up next, folks, we ask the questions you want to know about when we may expect a return to normalcy. We'll talk about schools, restaurants, and what's being done to help workers affected by this virus. Stay with us.
Now, more Facts Over Fear, the coronavirus. Now, here's Mark Curtis.
And welcome back, everyone. In this segment, we're going to discuss when we can expect a return to normalcy, if there ever is going to be such a thing again. This segment, we are joined by the Secretary of the Department of Health and Human Resources, Mr. Bill Crouch. We appreciate you being here, and also Dr. Kathy Slemp, who is the West Virginia Public Health Officer. We have a question from one of our viewers that we'll start out with here. This is Alicia Odell of Charleston. She wants to know the latest on the school situations. We know the governor ordered them closed for 2 weeks. I know you guys aren't the superintendents, but I assume you get consulted on things by the Department of Education about schools and what to do.
Absolutely. So we work really closely with the Department of Education and Superintendent Birch. And so the thought was, let's go ahead and close them for 2 weeks until we knew more and could reassess the situation. So that's what we'll be doing.
I know that people want to know, is this just going to be for 2 weeks, or is it going to go the whole year, the end of the school year? We really don't know at this point, do we?
Well, one of the things I think is important, as Dr. Marsh mentioned, we really are trying to keep what would be a very high peak that goes up and then down quickly, and we're trying to swell that tsunami into a longer, lower peak. So it's a much more manageable situation. So that means it actually extends a long time sometimes, and so it could be certainly that it's over a few months that we really are seeing how this plays out in the communities. But we just have to wait and see.
We are going to get a question here about the situation with the schools, because a lot of people, especially the colleges and universities, have transitioned to online classes instead of in-person classes. Even the elementary and high schools are doing some of the lesson plans online because kids are out of school. Is that, from a health standpoint, is that a wise thing to do this in an online platform, at least for now, keeping people separated that way?
Absolutely. That's as the governor stated very clearly, that's what we have to do if we want to break the transmission of this disease. If we can separate and we can keep folks apart, and I say this over and over, we have to take care of our families. We have to take care of our parents, our grandparents, and our great-grandparents. So everybody's got to work together to make this happen and to reduce that curve.
I know you two are in the health field. Of course, telehealth has become a big thing now. So the worlds of telehealth and communications and medicine have kind of crossed paths. We know we have a broadband infrastructure problem in this state. Our senators and Congress people are working on this as we speak. The legislature worked on. How critically important is that we get broadband improved in this state so that we can do things like telehealth and more education in the classroom from a remote setting?
It's becoming more and more important. We have communities right now out there that do not have internet. We have folks who can't get cell service. So to try to communicate with patients and not have them come into the physician's office or to the local health department or to their physician directly, we've got to have some sort of communication. There is an effort to waive the video portion of that and just be able to do some of that on audio. So that may help. But it's incredibly important in terms of being able to reach people.
I want to switch gears here. We're going to make a complete left turn and talk about restaurants and bars. And again, as health professionals, you guys probably had to weigh in on this. This is from Tina Wari, who is watching in the Northern Panhandle on WTRF TV. She says she's a self-employed bar owner and asks, with the bars being shut down and no income, what options for assistance do we have? This is echoed by Angie Nicholson of South Charleston, who says she is self-employed, losing hours and worried about trying to pay her bills. What do you say to these two women? And I guess, you guys, the governor made ultimately the decision, but I'm sure you get to weigh in on the concern about having bars and restaurants open and, again, people in close quarters. What was your advice to the governor?
Well, we are always trying to balance the risks and benefits of these decisions. As we know, as we've heard from the governor, we've heard from Dr. Marsh, that physical distancing makes a difference, an enormous difference. And so we have to deal with it. We have to keep our community functions moving forward. That does cause sacrifices and challenges. And so this is where I think our president and the governor are really stepping forward and saying we have got to make people whole with this. So there are efforts through Congress. The governor has talked about his ability to do that. Looking at unemployment, they are tracking that closely so they can actually support that much more quickly. So they are actually absolutely trying to address those issues. We
did have kind of a compromise decision on this issue, Secretary. You can't sit in a restaurant and eat, but drive-through carry-outs and those types of deliveries are still available. Was that a good compromise, and is that a good way to, a healthy way to keep the restaurant industry going, although nobody in the dining room?
That is exactly the way to go forward. And again, the reduction of people in close proximity. Kathy's closer than 6 feet from me. We truly practice that during the day and in our meetings. And let me say just a minute to everyone that these decisions were incredibly difficult. Yeah. I'm not sure people understand how difficult they were. And I just want to make sure everyone does know that the governor stood up and made these decisions, didn't need a whole lot of input, because he recognized, looking at the data, once it was, and Clay Marsh is just fantastic, once that was laid out in such a way that you could see the results if you didn't do what was proposed, and the governor stepped up and jumped up and said, we've got to do that.
And I promise we'll jump back in when the governor comes back. He's going to rejoin us in another segment. I'll talk about what's being done to speed up unemployment applications and get the benefits to the folks that need it as quickly as possible, because I know he took action on that very subject today. I want to ask this one. This is from Amber Miller. She's watching on WVNS. She wants to know about people in the state who are in recovery programs. She says, quote, we still have to go into our appointments, which are always packed full of people. The state can request that stable patients receive 28 days of take-homes of their medication. She wants to know if you're going to be there for those who are in recovery. Obviously a very serious issue in the state. We don't want to cut those folks off.
Absolutely. And I think this is another example. There are critical, essential services we have to do in different ways, in new ways. Just as we've heard about it, schools are doing that, restaurants and bars are doing that, and this is another area. Health is doing that. So there are those changes of being able to take home medications as well, to be able to think about how can you use telehealth in that setting, how can you meet in smaller groups of, say, 10 or so that are stable. So those are the kinds of things. This is about how do we maintain critical essential services to people in ways that are creative and different.
All right, we're going to come back. We've got to take a break here, but we're going to have you both back, and we'll have the governor and Dr. Marsh back. We're having a great roundtable discussion here on these issues. Coming up next, we will have more of your questions, concerns, and comments concerning coronavirus. Stay with us across the Nexstar Media television network here in West Virginia.
Now, more Facts Over Fear, the coronavirus. Now, here's Mark Curtis.
And welcome back, everyone. Thank you for joining across the state of West Virginia and our neighboring states as well. I'm again joined by Governor Jim Justice and Secretary Bill Crouch. This is a presidential election year, and of course, West Virginia's primary is fast approaching. It is scheduled now for Tuesday, May 12th. Governor is, and I understand you would have the ultimate authority to pull the plug, but as of now, is the May 12th primary going to go on as planned?
I think so. You know, elections are really difficult to change. But in all honesty, let's just be fair. This is the very last thing we need to think about at this time is an election. I mean, really and truly, for right now, that's the last thing on my mind. And really, we got really serious stuff here to take care of, and that's where I'm going to stay focused.
But we've seen other states postpone their elections or move them back deeper into the year, their primary elections. And let me talk about this because I was at the news conference yesterday with Secretary of State Mac Warner and Attorney General Patrick Morrisey. Here's the plan in West Virginia. You guys have both, I assume, been filled in on it too, where they're encouraging more people to vote by absentee ballot. You have to, when you apply for an absentee ballot, there's several boxes you can check. I'm deployed in the military overseas, or I'm out of the country on travel. And one of the top boxes, I believe it is the top box, is the medical exception. So if you have a medical disorder that prevents you from getting to the polls, you can get an absentee ballot. The ruling from the Attorney General and the Secretary of State concurring yesterday was that fear of the coronavirus, just the simple fear of the possible transmission of this disease, especially when elderly folks vote in high numbers, and most of our poll workers are senior citizens. So if you apply for an absentee ballot, check the box, I have a medical concern for coronavirus. You don't even have to say coronavirus, just check medical concerns. You can get an absentee ballot, and they think maybe tens of thousands of people will vote by mail instead of showing up at the polls. Good idea, Dr. Crouch?
Anything that distances people. So if we do continue with the election and folks do go to the polls, they need to practice that social distancing. They need to keep that space between them. So that's difficult to do when you've got a very large crowd, which is why some of the decisions that the governor's made have been made. We're trying to protect the people. That's our job.
And of course, Governor, you signed a bill this year to enable the mobile voting app, which was just for military service personnel serving overseas. Now, many people with disabilities in the state of West Virginia can vote by mobile app too. I mean, you probably weren't thinking coronavirus when you signed that, but it's going to apply to them, isn't it, and be a benefit?
Well, sure. And at the end of the day, anything we can do to make it easier for people to vote and participate in elections is great stuff with me. That's all there is to it. But I'm just telling you that today, you know, we need to stay focused on this, because this could be a disaster beyond all of our comprehension. So we'll stay dead focused on this. We'll get to that. There's all kinds of intangibles and everything that'll come up in regard to that, but we don't need to get in that today.
No, well, it's certainly timely this week because Ohio had a primary. It got canceled, and of course the situation in Ohio is far more dire than it is here. Let's take another viewer question. Joshua Hendricks, who is watching in Summersville on WOWK-TV, asks, what are your thoughts on all the projections of the mortality rate being tied to a flawed and limited worldwide testing system that is only testing mainly people exhibiting intermediate to severe symptoms? He is citing an article from Stanford University doctor on this study. But look, that's, I guess, the overarching question here is the concern about testing and not having enough in the state so far. We know more help is coming. Both of you address the issue of testing and getting more of it now.
Well, I'll lead off and I'll say just a few things, but I think the facts are really simple. As far as worldwide, or especially from our country wide, we didn't have enough testing kits. That's all there is to it. And so we're behind the curve on that. But we're catching up really, really quickly. And to be perfectly honest, within our state, Dr. Slim, you know, our secretary have done great work and everything, and we haven't been completely out of kilter as far as having enough tests and everything to be able to move forward in the right way.
That's correct, Governor. And our commercial labs are coming along very quickly. We have, and Dr. Marsh talked about the number of tests reaching about 500. We have other commercial labs coming online here within the rest of Friday and Monday, starting Monday. So we expect that number to pick up quickly. With regard to the articles, I read more scientific articles than I've in the last week than I've read 2 weeks in my life, and we have pretty good data. We know what happened in China. We know what happened in Italy, and we know what happened in South Korea and Iran. So when you model those numbers and you look forward, we know what we need to do to stop the spread of this virus. So we believe we have good scientific data to make the decisions.
Let's get another viewer question in here. This one is about taking care of our people, this time coal miners. This question comes from the Tackett family. They write, is anyone thinking about West Virginia coal miners? Most coal miners have some degree of black lung, and a respiratory infection such as coronavirus could be detrimental to them. They deserve the same consideration as our schools, restaurants, bars, and other businesses. Gentlemen?
Well, first and foremost, this is really, really easy for me because my family's been in the coal business forever, and there's nobody who's going to stand up for the coal miners more than I'm going to stand up for them. And I absolutely am very well versed on all the problems that our miners could have. And we absolutely need to be concerned about that because that's like I said earlier, you know, not only do we have an elderly population, but we have miners that have black lung or COPD and all those issues and everything, along with the other complications that can come from that, whether it be diabetes or whatever it may be. But nevertheless, you are absolutely correct. And the same science, you know, holds true for our miners or our elderly or anything. And that is just simply this. We have got to get apart from one another, and then we break the chain and we break this terrible disease.
Yeah, and that chain also includes hand to mouth. We have a nose and eyes, and habits are hard to break. I tell everyone my eyes only itch when I think about not touching my face.
And so I'm terrible at that too.
We all have to do that. It's very difficult to break habits.
Yeah. What would happen? I mean, coal miners work in very close quarters, too, don't they, in many instances? How do you deal with that?
They do in some instances, but at the same time, you know, the thing, as far as the work inside the mines, I wouldn't be too terribly concerned about that because 6 foot gives us a lot of space and all that kind of stuff. The problem is outside the mines, the gathering together or riding into the mines, we got to be really careful about that on the man trips. But in addition to that, the bathhouses, you know, we really got to watch really closely there. But as far as the outside surface mining activities, we're good to go there.
Secretary Crouch, it occurs to me, one of the problems we've all been trying to get our arms around in the state is vaping, smoking. We have one of the highest smoking rates in the country. So we already have a population that has lung problems, respiratory problems as it is. How much does this make them more vulnerable to coronavirus?
As Clay said earlier, we are the #1 state in terms of risk once this disease reaches us. And we've also said, and we've talked a great deal about, we're low risk with regard to the disease being coming to West Virginia and affecting people, and that we ended up being the last state. Now that it's here and it's beginning to see more cases, we have not only an elderly population, but we have a population below age 65 adults who have a lot of comorbidities. We have folks with congestive heart failure. We have individuals with cardiovascular disease. They're high risk for COVID virus as well.
Governor, a question came up. We're going to take a left turn here because a question came up last segment when we had Dr. Slemp out here, and this was not really pertinent to her. Secretary Crouch, what are we doing about the unemployment benefits? I think you took some action about that today. The Chamber of Commerce wanted to speed up not only with the state level but the federal government to get unemployment benefits immediately to people who need them.
We've done everything from just drop all the regs from the standpoint of the 1 week, you know, waiting period and all the different things to be able to process everything. We bring in all kinds of extra people in to process quickly and everything else because you're exactly right. I mean, if you're home and you're worried about being able to pay your power bill or whatever it may be, we've got to take care of our people. And I truly believe our nation's stepping up. We're stepping up. And let me just say one other thing real quick. Sure. Last night, we had 2,600 applicants, you know, came in as far as workers' comp stuff. I mean, and I'm sorry, unemployment stuff. And nevertheless, a normal month would have been 5,000. You know, we're having to process thousands upon thousands, you know, right now.
Let me ask you another question that relates to everybody in the state who collects a paycheck, and especially those who are going to be losing a paycheck for a while. Lori Geisler, who's watching on WVNS in the Beckley area, she asks, will the deadline to pay state taxes be delayed like they are doing with federal taxes?
Well, it's possible. It's possible. All of our people are working on that right now, and again, it's just a simple matter of everybody stepping up from the standpoint of the federal government saying anybody that's got a mortgage, nobody's going to get kicked out of their homes and everything until, for a good little while and all this kind of stuff. There's so many different things that we got to do, but that's something we're looking at.
All right, we're going to take another left turn. This thing has more facets than a diamond and so many that's seemingly unrelated. But Governor, right now, West Virginia parks, state parks remain open, though some facilities may be closed. Do you anticipate state parks will remain open or closed? And if they stay open, what's the advice to park goers?
They're going to absolutely stay open. And what we want people to do is go to the parks. Go to the parks and get out in the clear air and walk and everything. Don't gather up in crowds and everything. But if they want to go to a state park and enjoy the beauty and everything, nothing is more calming and better for the soul than our state parks. They're beautiful beyond belief. And go to the parks. We're going to absolutely keep our parks open.
I'll ask Secretary Crouch to chime in because we had some video on the news tonight of people on beaches in Florida, spring breakers, and yeah, they're out in the open air, but they're all bunched together on the beach. I assume we don't want to see a similar scenario in our state parks.
Well, the state parks are a little different than the
Yeah.
beaches. We've got to have the young people buy into this. It's difficult to do. Spring break time, kids want to get away. They want to go have fun, and that is fine. But we've got to have their buy-in on this to really make this work.
Yeah, let's talk about another related question, this one, because it's all involving travel. This one comes from Carol Ivanovich, who is watching on WBOI TV 12 in Clarksburg. She says her daughter lives in Connecticut, and she is torn about visiting her because she is in her early 70s and her husband is 66. Do you think she should make the trip? What do you guys advise on trips and travel, gentlemen?
Well, first of all, I don't know why you would want to go to Connecticut. When you've got all the beauty and the greatness here, have your daughter come to us. And so all that being said, I would always caution, if in this situation we're driving out of state, and I only say that in a little bit of jest and everything. But I want you to be cautious and know how serious this is, and so just take all the precautions and be wise.
Yeah, we're always trying to get more people to visit the state. Tourism is one of the big things we're trying to boost, and I heard today that air traffic within the planes departing and coming in at Yeager Airport is way down. And I would imagine that's a function, Secretary Crouch, of people not wanting to be in close quarters or taking that advice.
That's absolutely right. We go back to the same thing every time. People need to distance themselves from other people. Going other places, traveling outside of the state, getting in crowds at beaches does not work in terms of reducing the risk. And that's what we're trying to do, is reduce the risk, make people safe, give them an opportunity here to get through this without getting the virus and without getting sick. And again, our elderly are the ones we really need to protect the most.
And I know one of the things that's so near and dear to the hearts of West Virginia is being able to go to their place of worship on Saturday or Sunday. A lot of churches have canceled service. My church, which is First Presbyterian in St. Albans, we're broadcasting our church service with nobody in the church, just the minister and the organist, over Facebook. And a lot of other churches are streaming their services too. So there's ways to participate, even though the non-traditional approach is probably jarring to some folks. Safer.
It's surely safer, and from that standpoint, but I'm a man of faith, and I'm really proud that I'm a Christian, and I would never say, we shouldn't have church or we shouldn't go to church and everything. If we go, let's just be smart again. Let's just sit apart and enjoy church in that way, and bump elbows and be happy.
Yeah, that's the first place I experienced it when they do what they call the passing of the peace in church. The minister said, everybody bump elbows, and we're all running around hitting each other's elbows. It kind of looked like roller derby, and people chuckled a little about that. But, it's a safe way, because normally people hug and shake hands and high fives and those kinds of things. Any other practical advice for folks out there? We've talked to a lot of different things here.
I would go back again to my mother's 89. I told her last week she couldn't leave the house, and we're shopping for her. We're getting her prescriptions for her. My daughter shopped for her. My wife took the groceries to her. Everyone needs to do that. Take care of your families. The final thing I would just want to do is say, I want to thank our workforce out there. We have essential Government has essential and necessary services that we have to keep operating. Our facilities in the state, we have 4 long-term care facilities, 2 psych facilities, an acute care hospital. We have folks down there every day, every night, 24 hours a day. I just want to thank them. They're doing a great job. It's a difficult job, and they're doing a terrific job.
God bless them for taking the care of the people that have the need most. We're going to continue our discussion. We're having a lot of great information shared here, and coming up after a short break, we are going to get to as many of your questions as we can. We're back in 2 minutes. Stay with us.
Now, more Facts Over Fear, the coronavirus. Now, here's Mark Curtis.
And welcome back to this special edition of West Virginia Tonight. Let's take a viewer question from the Eastern Panhandle, where they have had a confirmed case of COVID-19. This comes from Monica Turner, watching on WDVN. She says some folks have tested positive with no symptoms and only got tested because they were exposed to someone who did test positive. So now that we know you can have the virus with no symptoms, why are people being refused the test when they have some of the symptoms? Doctor?
Well, I think that this is a really important issue with COVID-19. We know that one of the characteristics of this virus is it's in high concentrations in people before they get symptoms. So as we expand the ability to test people, and we are, then we will start to look at that at our greater population. But now we have to test people that are sick, and also so that the healthcare workers will know it, and also so we can track their contacts to make sure that we don't have outbreaks, clusters, as the governor said.
Yeah, we should mention, if you're just joining us, that the governor has been tested, came up negative. Someone who has the virus in the Eastern Panhandle was with you, in fact, hugged you, and therefore the red flags went off and you got tested and you're all good.
Yeah, and I hugged them too. They're really good people, and I surely wish and hope and pray they'll be fine.
If he got a hug from you, I bet he never forgets it, right? All right, let's talk about Idina Treen here. This is another question. She's watching in the Wheeling area on WTRF, and this question again is about testing. She wants to know, how long does the testing take? How long does it take to get the results back? Doctor?
Yeah, so the testing can be done as fast as 8 hours, and a lot of that now is just looking at how we can ramp up the ability to do this. But let me just make one point that I think is really important, that we have to take care of ourselves. So the way that we protect ourselves from getting the virus is not just getting tested and no yes or no. It's washing our hands, it's not touching our face, it's separating. The governor has given us clear instructions. He is so spot on right now, and I'm so proud of him for the decisions he's made. But it is time for us to follow the governor's lead and to answer the call to arms, to do the things we can do to make our state the beacon for others.
I know the governor wanted to circle back and talk about unemployment benefits. Let me read this question because it may tie in. This is from Annette Skaggs-Tolley, who is watching on WOWK. She wants to know if people on Social Security or SSI are going to receive help from the federal government, and she asks, what about increases in SNAP benefits for these same people? I don't know if you can address those. If you can, go ahead, especially because I know we had some bills on SNAP benefits here in the state this year, but circle back and certainly talk about unemployment benefits.
Well, here's the bottom line, and I just want everyone that's been laid off, and or is fearful of being laid off. The unemployment benefits will come, and they will flow faster than have ever flowed before, and the processing will be faster than ever before, and everything. And so, don't be fearful that you're going to be left out in the cold. And as far as other types of benefits for our elderly or for those, that in need of food and all that, I would just say just this. And this is the biggest thing I want to say, and that is, from the standpoint of our nation and a stimulus package, just imagine that the first part of the stimulus package was $100 billion. If we were to get our 50th of that, it would be equivalent to half of our entire budget almost. And if that grows to $1 trillion, 10 times of that, and everything, the monies that can flow into this state are unbelievable and everything. And so our nation, President Trump, our nation and our state is going to try to take care of us economically. We need to be fearful to take care of us from the standpoint of our health. And that's the thing that is the most on my mind.
I want to talk about another thing that's near and dear to your heart, because there was kind of a humorous moment in one of your news conferences the other day when you said, don't run out and try to buy all the toilet paper in the store, and everybody chuckled, but it's a real issue. And I want to mention this because the Food and Drug Administration says there's no need for people to empty the store shelves. Right now there are no nationwide food shortages. In fact, the FDA Commissioner, Dr. Stephen Hahn, says Americans should only buy enough food to last a week. Yet despite this, you walk into your neighborhood grocery store and the shelves are bare. And I was telling you about being in Kroger last Saturday and almost seeing a fist fight. What's your advice to the general public about shopping and thinking about others at the same time?
I would say, follow the lead of our president and what is coming out on a national basis. We have no food shortage and everything. But I understand people being concerned, people being afraid. I understand, what they're trying to do. But that hoarding of the food is running, is taking your dollars, and really and truly that being in a grocery store and running over top of each other and everything else is causing another potential problem, that you're interacting close with people. And so we don't need to do that. Everything's okay at the grocery stores and everything. It'll be okay there.
You're a doctor. There's such a thing as buying too many groceries, right, in the medical profession?
But I think the governor makes a really important point, and obviously lots of people are uneasy right now, and the hope is that we'll be the place that will show the rest of the country how to behave. But we really want to make sure we keep 6 feet separation from each other. So the crowding and the going after things together brings people together. We need to keep people separate.
I want to bring someone else into the conversation today. Earlier today, I had the opportunity to speak to Senator Shelley Moore Capito. She's in Washington, D.C., working on this very crisis, and here's what she had to say.
We're hoping to get specific action here in the next 2 or 3 days. We've been working with the White House. I'm on the healthcare task force issue, which is going to really alleviate some regulations and some rules to make billing easier, to make accessibility to hospitals for different beds easier, and relieve that regulatory burden so that during this emergency we can answer the call a lot quicker. We also are going to put into the package through our financial institutions, whether it's a bank, a community bank, a credit union, some availability of cash for our small businesses to get them over the hump. Because once we see this smoothing out, people may not be working for a month or two, but if they don't have a job to go back to, that is really going to be difficult. So we want to try to keep those small business people working, and so we're working on different creative ways to either create grants, loans, have accessibility to liquidity for them.
And essentially, Senator Capito is saying she's working on small business loans, the unemployment issue. You mentioned how important is it that you guys work hand in hand with our team in Washington, D.C. to make this stuff get done?
It's essential. All of our congressional team, I just got off the phone with Congressman McKinley, and all of our congressional teams working really hard on this. And we appreciate Shelley. We appreciate everybody.
Well, we appreciate you and Dr. Marsh for being here, as well as Dr. Slemp and Secretary Crouch. We're going to give you a minute and a half, 2 minutes to finish up with a closing statement here, Governor.
Well, the first thing I do is thank Dr. Slemp, Secretary Crouch, my good buddy Clay Marsh, all the people that are working behind the scenes that are really, really putting in the hours and everything, and they're trying to look after every one of us. But I would end by just saying this and only this. This is our time, West Virginia, to really, really shine. We can take care of one another, and we can make West Virginia look like a beacon that is unbelievable. And at the end of the day, the whole world's watching us already, because we were the last state to not have a case and everything. And so as the whole world watches us, and as we change and become that diamond in the rough and everything, when this will end, and if it ends well for us and everything, we'll be the place everybody wants to come. And that's just what I want.
All right. Well, I'm going to paraphrase a soundbite we used from one of your briefings in our news coverage this week, where you said we're all Mountaineers strong, and amen to that. I'm going to give you a little elbow bump since we can't shake hands again. Governor Jim Justice, thank you. Dr. Clay Marsh from WVU Health, thank you. Again, Kathy Slemp, the state's public health officer, who's a great addition to your team. We really like working with her in the media. And Secretary Bill Crouch is also also has provided a lot of good information. We want to let our folks know on all the Nexstar Media television stations around the state. For more information, just go to the website of the television station you are watching this program on. We have lots more information on coronavirus, and of course, stay with all Nexstar Media television stations for the latest information on this pandemic. Thanks for joining us this evening, folks.